scans indicate that parietal and frontal lobes are primarily involved in the basic mental mathematics. For example, counting forward or doing serial calculations. However, other areas of the brain are recruited into action when dealing with more complex calculations. Few researchers have been studying why students have problems with learning early mathematics, despite normal intelligence and adequate instruction. About 6% of school-age children have some form of difficulty with processing mathematics. This is about the same number as children who have reading problems. However, because of the strong emphasis that our society places on the need to learn reading, many more research studies have focused on problems in this area than on mathematics. Nonetheless, the growing number of students who are having problems with mathematics has renewed research interest in how the brain does calculations and the possible causes of mathematical disorders. Some children develop a fear or phobia of mathematics because of negative experiences in their past or a simple lack of self-confidence with numbers. No doubt, mathematics phobia can be as challenging as any learning disability, but it is important to remember that these students have neurological systems for computation that are normal. They need the help primarily in replacing the memory of failure with the possibility of success. Students with mathematical disorders, on the other hand, have a neurological deficit that results in persistent difficulty in processing numbers. One critical factor in how well students learn mathematics is the quality of teaching. Recent studies show that student achievement in mathematics is strongly linked to the teacher's expertise in mathematics. Students of an expert teacher perform up to 40% better on achievement tests compared to students of a teacher with limited training in mathematics. Right is heavily involved with number organs. Damage to this area can result in difficulty. Studies of individuals with Gerstmann syndrome, the result of damage to the parietal lobe, showed that they had serious problems with mathematical calculations as well as right-left disorientation, but no problems with oral language skills. Genetic factors also play a role in causing mathematical disability. For example, studies of identical twins reveal close mathematics scores. Children from families with a history of mathematical giftedness or retardation show common aptitudes with other family members. Girls born with Turner syndrome, a condition caused by the partial or complete absence of one of the two X chromosomes normally found in women, usually display dyscalculia among other learning problems. Individuals with visual processing weaknesses almost always display difficulty with mathematics. This is probably because success in mathematics requires one to visualize numbers in mathematical situations, especially in algebra and geometry. Students with sequencing difficulties may have dyscalculia because they cannot remember the order of mathematical operations nor the specific formulas needed to complete a set of computations. understanding of small numbers and quantity appears to be present at birth. The understanding of larger numbers and place value, however, seems to develop during the preschool and early elementary years. Studies show that most children with mathematical disorders nevertheless have their basic number competencies intact. Studies of children with mathematical disorders show that they have deficits in counting knowledge and counting accuracy. Some may also have problems keeping numerical information in working memory while counting, resulting in counting errors. Children with mathematical disorders have difficulty solving simple and complex arithmetic problems. Their difficulties stem mainly from deficits in both numerical procedures and working memory. Moreover, deficits in visual spatial skills can lead to problems with arithmetic because of misalignment of numerals in multi-column addition. Although procedural, memory, and visual spatial deficits can occur separately, they are often interconnected. Students displaying procedural disorders use arithmetic procedures or algorithms that are developmentally mature, have problem sequencing the steps of multi-step procedures, have difficulty understanding the concepts associated with procedures, and make frequent mistakes when using procedures. The cause of this disorder is unknown. However, researchers suspect a dysfunction in the left hemisphere which specializes in procedural tasks. Students displaying memory disorders have difficulty retrieving arithmetic facts, have a high error rate when they do retrieve arithmetic facts, and retrieve incorrect facts that are associated with the correct fact. Here again, a dysfunction of the left hemisphere is suspected, mainly because these individuals frequently have reading disorders as well. This association further suggests that memory deficits may be inheritable. Students with visual spatial deficits have difficulties in the spatial arrangement of their work, such as aligning the columns in multi-column addition. Often misread numerical signs, rotate and transpose numbers or both. Misinterpret spatial placements of numerals, resulting in place value errors, and have difficulty with problems involving space in areas as required in algebra and geometry. This disorder is more closely associated with deficits in the right hemisphere, which specializes in visual spatial tasks. Some studies suggest that the left parietal lobe may also be